Very good afternoon, everyone. Thank you so much for joining in this afternoon for our session on diabetes. We have a renowned speaker today who is going to take the session for us. Let me introduce our speaker first, and then we can move on with the session. So, Dr. S.G. Moazam is a senior consultant physician and diabetologist in the Department of Internal Medicine at Sunshine Hospitals. He has overall 15 years of experience as a consultant, internal medicine, and as an ER head. He has been a clinical head at Apollo Sugar Clinic for about 8 years and also worked as a consultant physician at Apollo Hospitals. And from 2001 to 2002, he has the distinction of being the consultant who contributed the most in terms of emergency services. During the same period, he was also recognized as the most proactive consultant of the year. In the year 2008, Dr. Moazam was the lead in designing, planning, and implementing the diabetic program of the Apollo Hospitals, Apollo Sugar Clinics, pioneering an effective chronic disease management program. We welcome you, Dr. Moazam, today to our session, and I'd like to open the stage for you to come in and take the session.
Thank you so much for having given this privilege and honor of addressing a very reputed company and its employees. Today, I thought that I would focus on chronic disease management. And today we are going to talk about a very chronic ailment that has been troubling the entire world. In fact, we have almost around 72.1 millions of diabetes around the globe, and India stands at around 69.6 million diabetes. So I thought that it was mandatory to speak on a topic like this, and I have did my MBBS from Alamein Medical College, Bijapur, and then went on to do my MD Internal Medicine from Gulbarga MRMC. And then I did my research work in Howard Medical College in Joslin, which is called as the Mecca of Diabetes, where I did my research work there. From my project was research to practice, and then I was the spearhead in starting the concept of chronic disease management in India. And but the first of its platform which we initiated was the sugar clinics in Apollo. So that was my baby. And then from there on, I have been working on this chronic disease management platform for quite a long time. And I thought that it is mandatory to create this sort of an awareness in among our people who are at a large suffering from this particular disease, especially so the complications that are setting in much earlier for all the patients over here. So by definition, if I'm able to tell you that what this diabetes is all about, if I had to put it in a very sweeter tone, I would say that this is a very friendly enemy, a very friendly enemy. You just imagine that how our body has been created like a miracle. You once you understand that how it is all about, then you would know that how the system works and where the malfunctioning happens and how do we go on to get the diseases. Just imagine, the God Almighty has made us so beautifully. If anybody could understand the miracle that's there within the system and how it operates and how it works with the diurnal variation of day and night, I'm sure you would be just bow down your head in humility and say, this is amazing. This is something which we cannot even think and imagine. So to start with, let me tell you that the disease per se is not, it's an accumulation of certain symptoms and signs and all that. So people say that when you give a definition of a disease of health, somebody keeps it, tell you to define health, they will say it's a disease-free state. No, it is not a disease-free state. It's a positive health. It's a positive health, but it has too many inconditions along with that. For example, you have the spirituality, you have mentally, you have physically, and so many attributes that help you to live a longer life as what our sages had done in the earlier past. They had defined life, how it could be, how it should be led, and how we could go on and mingling with the nature to understand that how your life can be disease-free and you can live comfortably for a period of the years destined, say for 100 years. Can you imagine a small two body fluids in the body mixing with each other, and over a period of time, the miracle of God works and then turn into bones and flesh, and then a small baby is being born, and that small baby turns into a small boy and a small girl, whatever, and then they grow to be a young boy and a young man, an adolescent, and then a middle-aged man, and as an old man, and try and live to the timeless time till say the age of around 1995. How is it possible for a small thing of two fluids traversing time and coming in contact with so many diseases, viruses, and getting certain diseases on the way, accidents, happiness, sadness, and all those the terms and tabulations of different viruses coming. And now we recently had the pandemic of COVID, and traversing all these times, carrying certain diseases on the way, and then some diseases you may drop on the way, and then there are certain diseases you carry to the time God destined for you to live, say 90 years, but still you don't die of the disease, you die of some other cause. So basically, what I wanted to emphasize on is the whole life begins in water, and the whole system within the body is more of a beautiful chemical engineering. And this is how the hormones and the chemicals that are released. So somewhere, what I want to make a point is that somewhere God has made that system within the system to make you travel from this particular time, from the time of your evolution to the time destined to live for the number of days with God at this time. How is it possible for things to happen like this? Unless and until God had given something within the system to make you travel like that. And when this system is disturbed over a period of time, then on, that's where the problem of the disease sets in. It's not only a mental disease, it's a physical attribution, it's an involvement of the organs. And if these chemicals are not kept in balance, so this is what we call as hormones in harmony is what is required. But there are too many prerequisites to understand why this sort of a phenomenon happens within. And so, say 18 years of my practice, I'm still not able to understand this miracle. And every day, new findings do come up, and every day, new lessons to be learned. So, but nonetheless, we will be focusing today on the most important disease, diabetes. Diabetes per se, as per definition, people say that it's a metabolic disease. As per the definition, it's the body's inability to produce enough insulin, or to cause the elevation of the blood glucose, because this is the key hormone that is required, which comes from the pancreas. So if the body is not able to produce it, or if it is producing it not being utilized, wherein it is not able to shift the glucose that is coming after we ingest our food, and the amount of glucose after the food is digested, and the glucose that develops into the bloodstream, and that has to be shifted into the organs and other parts of the body to be used as fuel. But this is not going to happen unless and until the key hormone is in balance, and that is the insulin. So when we don't have insulin, and that's where the problem happens. So what is happening exactly within the system with the pathology? There are some many different opinions regarding the types of diabetes we have. We have what we call as the type 1 diabetes, we have type 2 diabetes, and then we have the gestational diabetes, and we have something what is called the pre-diabetes. I'm sure that it is time that we need to emphasize more on what is on pre-diabetes. I'm sure many of you have already known what is type 1 and type 2 and gestational diabetes. And there's one more that is missing here, is called as maturity onset of diabetes in young. And I will be eliciting on that as we go on. Now, why are these mentioned as type 1 diabetes and type 2 diabetes? Now, you look at the evolution. So, as the child is born, the children who are from 4 to 6 years of age tend to develop what we call as type 1 diabetes. And people beyond the age, and then the children have a bimodal pattern. In fact, they have it from 4 to 6, and from 2 to 4, from 2 to 4, and then there's something from 6 to 11. So this is called as type 1 diabetes. This is the phase which they can develop diabetes, type 1 diabetes. What does type 1 diabetes mean actually is that the pancreas, which you call from where the insulin is produced, is totally defunct. The cells are not capable of producing even a single ounce of very little of it, which cannot be even utilized. So they come into the category of what we call as type 1 diabetes. We have type 2 diabetes, in which the 50% of the pancreatic cells are working and 50% of the cells are not working. So the 50% of the cells are not working. Because of that, the insulin that is being produced is not sufficient enough to remove the glucose from the blood vessels and shift it down into the periphery to use as fuel. And then we have gestational diabetes. See, what we call is that stress-induced problems which we have. Gestational diabetes is basically diabetes that is detected during the trimesters of diabetes. For example, you may get it in the first trimester, or you may get it in the second trimester, or you may get it even at the third trimester. because pregnancy itself is a very stressful state. So what happens during pregnancy, because of the hormonal imbalance that happens, because it's a very stressful state, a new body is growing within the system, and that has a lot of stress on the body, and thereby sometimes you get this what we call as decoding, the decoding of the system. You'd be surprised that you would have heard from your relative that she developed this problem during her gestational period, during pregnancy. For example, they say that people will identify that she had developed hypertension during pregnancy. She had developed diabetes during pregnancy. She had developed thyroid during pregnancy. So these are what we call as decoding. When you're put under a lot of stress, you start to decode. For example, like how happily we will be able to take the property papers which our parents give it to us and we sign them. Certain things come in hidden envelopes, so we need to accept them also. So it is not that. So this is what I'm trying to emphasize is the genetic predisposition. So the genetic predisposition is only 1% of it. The 90% of it is what we call as stress. So this is a stress-induced disease, and this is a lifestyle disease, and that's how we get when your lifestyle is totally disturbed. So gestational diabetes is one when we have what we call as during the pregnancy when there's a lot of stress. Now we come to the pre-diabetic stage. So when you come to the pre-diabetes stage, how do we know that that your body is already you are suffering from it? Though you may not have the classical symptoms, like for the most classical symptoms of diabetes are that when you have excessive urination, excessive thirst, and excessive hunger. Okay, these are very classical traits of what we call as diabetes. But not all may be able to feel the same symptom. Like like when our faces don't match each other, even in our own relative, in our own homes, when our faces don't match each other from the same progeny, so each one will have a different inclination to feel differently because each system works in a different way. So what the other person and people get misled by the fact that oh, this person is have it, I may not have it, I may not be like this. I'm a different person. No, it's not so. You're a different person, no doubt about it, based on your personality. But nonetheless, but whatever is happening within the system makes you to do what the things which are not been happening. For example, when you're diseased, you behave differently. So this is what it is. So we need to understand that the pre-diabetic phase is an inevitable phase. Very difficult to diagnose. Not many know, and many of them will miss the bus. But I can give a very simple clue. If we are not able to identify through the symptoms, but there are ways by which we can able to know that how the pre-diabetes can be predisposed. For example, a very simple sign I will tell you. I'm sure everybody will look at it and know that there is, why I'm trying to tell you that this sign is so important. This is an early sign. We have tests in our condorum of medical labs to tell you how your sugars have been in a control on the span of 2 to 3 months. But is there anything that can tell you years ahead that you are going to develop diabetes? There's none such thing like that. We don't have any test on planet Earth to tell you that you will be getting something like this over a period of 5 years or 10 years or something. Then there can be any low postulation also based on that. But yes, we can genetically say that, if genetically you're predisposed, you may get into a period of 10 years, 15 years. But there is no such evidence to suggest that you may develop this sort of a disease. So, but the body speaks well in advance. You need to introspect and see what your body says. Why I'm able to tell you that? Because the research facility where I was in Jocelyn, so there we used to go through all the study, the human study that have been done over a period of time. There have been many trials that have been done. Humans have been followed for a period of 10 years, 15 years. And based on those trials, whatever the input we were able to get, and we were able to assess and understand that, oh, this is how the disease is be, this is how it can come, this is how it can behave, and this is how it can be controlled, and this is how we need to go about it addressing this issue. So very simple sign, I will tell you all how you can look for it to tell that or predict in advance that your body is speaking, that you're going to develop diabetes, is you just look at the wrist of your hand. You look at the wrist of your hand, you will find one line over here. You see, it looks like a broken necklace line. You see that? I'm sure everybody has seen that. The same line is found on the nape of your neck and the nape of your neck. This is the first telltale sign with the body speaking well in advance that your body is not using insulin properly. This comes secondly to what we call as obesity. People who are obese will have these signs. But it is the first telltale sign to tell the body is not utilizing your insulin properly, and that's how you are going to get type 2 diabetes. So important, such a beautiful sign. This is called as acanthosis nigricans. If you look at the nape of the neck, there's a simple eye screening way by which you can detect and tell in advance, or you can tell the person to please go and get yourself checked up because he would have already missed the bus of the pre-diabetic phase. Now, how do we conclude through the test that there is a pre-diabetic phase, so which we call as there is a test called as HbA1c. This is a glycosylated hemoglobin. This test is a metabolic memory. It captures the metabolic waves that keep changing from time to time and gives us a final product of what we call as the glycosylated hemoglobin concentration. For example, how can we, based on this, say that the person is having diabetes? We can say that, but it cannot be used as a screening test to say you have got diabetes. The screening test to do that is a fasting blood sugar, that is the most gold standard. And then we have a glucose challenge test, which is called a certified glucose. We give and challenge and then keep checking the sugars after that. We'll be telling you all on down the line as I tell you, but these are the important things to remember. So, but in pre-diabetic phase, we can use HbA1c to identify whether the person is already in the pre-diabetic phase. See, patients who have a HbA1c concentration of 5.5 to 6.4, they come into the category of what we call as pre-diabetic. People who come at 6.5 and beyond, they are taken as overt diabetes. So that is what the definition of pre-diabetes is all about. As I already elucidated, the type 1 diabetes is found when sometimes there is some immunopathology that is happening within the system. For some reason, our brain misreads our own components of our body and starts producing, giving direction to the immune system to go and destroy the cells. Though it is the same part of the body, but for some reason, for a fraction of a second, the brain misreads the components of own system and tries to produce antibodies and destroys the pancreas. So this is how the pancreas get destroyed, and thereby we will not be able to get insulin to shift the glucose from the blood vessels to the peripheries. So this is one way is been identified among the type 1 diabetes, and only 5% of the people have this disease. It's not preventable. There's no something we can stop it from happening. It has to only decode, and when it will decode, we do not know. But since because this is a non-modifiable risk factor, age cannot be reversed, or we cannot stop certain things from happening. As I already told you, the genetic decoding is happening. So whenever certain disease has to come, it will happen all the same way. So as I was already elucidating about what we call about the pre-diabetes phase and how does it happen, and how the immune system, for a moment, for a fraction of a second, the brain misreads of the own components of a body and tries to produce the antibodies to destroy the pancreas, wherein the insulin is not being able to produce, and that's why the glucose cannot be shifted from the bloodstream into the peripheries as fuel. So this is what is the basic pathology that happens within the system. Why it does happen? How does the mechanism go about? There are some predisposing criteria. Sometimes they say that it is genetic. Sometimes they say that it could be because of extreme weather, like being exposed to extreme cold or something like that. There are some papers which have come out on that front, but not very sure about it. And then the virus, of course, if there is a virus that can destroy the pancreas, I'm sure then that can figure out this. So this is the few things we can lead to what we call as type 1 diabetes. Now, what are the symptoms for diabetes per se to know that the person is really having this sort of, the early identification of the disease through these symptoms would help you to prevent the complications from setting in. So that is so important that these classical triad of things which you need to know. What does it happen? As I already told in the beginning, for type 2 diabetes, for everyone, for anyone with type 1, type 2, or gestational, or OD, or whatever. So these are the things that they go through. They have excessive thirst and they have increased appetite. And one thing about it is that though they may be eating so much, but they never tend to put on weight. In fact, diabetes patient loses weight. And I will tell you the reason why they lose weight is that if the sugars have not been in a control over a period of time, if you're not able to maintain the target HbA1c over a period of time, if you're not able to have a good lifestyle over a period of time, if you're not going to get proper sleep over a period of time, and then you will find that the complications are setting in. If you have a loaded amount of glucose moving from your bloodstream, and this blood is traveling to all the parts of the body and supplying oxygen to them, thereby it becomes friendly with them and causes what we call oxidative stress, and thereby causing some amount of complications to set in. Likewise, the losing weight component in the diabetic patient, and why the phenomenon happens is basically the kidney has a mesh. Okay, this mesh will prevent anything that is going from the bloodstream and to out and into what is being turned into as urine. So, but because of uncontrolled diabetes, the mesh of the kidneys is opened up wide. When it opens up wide, what happens is that some amount of proteins start leaking out of the kidney. So that's why if you have a wall, you need bricks. If no bricks, no wall. For the muscles, you need proteins. And these proteins, if the sugar is not under control, they tend to go throughout the kidney and lose this one. And that's why if you look at the elderly people and patients who have been for a long period of type 2 diabetes, of somebody who is a young man also, if is not able to has not been able to identify this disease problem, and then he also tends to lose, because then by the time they realize they've already lost sufficient amount of weight. And this phenomenon is only because of the loss of proteins through the kidney. It doesn't mean that the kidney is damaged. No, it doesn't happen. The damage to kidney and the complications can happen after 10 to 15 years, for a longer period of time of diabetes. It doesn't set in immediately. But yes, it can set in immediately unless and until we have foolishly taken medicines without consulting the doctor, especially so the painkillers. Be very, very careful about the painkillers. And you'll be quite surprised that in Hyderabad, so many of our kidney centers have opened up. So many of our dialysis centers have opened up. Why all this thing has happened? This is basically because people, even normal people, have got their kidney shut by taking those medicines which they were not prescribed. They just went and took the advice of the pharmacist, and then they get on and they develop this complication. So my sincere advice over here at this particular juncture was to emphasize that kidney, it can get damaged easily if you do not know that painkillers are the major causes. Now even the recent this one, the amount of antacid tablets, people are just taking it like vitamins, especially the antacids tablets like the Pantop, or any pantoprazole or omeprazole or any of the drugs which you're taking, because now they are coming with a warning. Make sure that do not just take them without the advice of the doctor, and for what period and what situation you need to be given, you please need to consult. So it is so important that be careful about this. So as we are coming to the kidney part of view, the kidney will not get destroyed immediately, but the proteins will start leaking. So this is the first little sign that you're losing weight. So then the other aspects is extreme fatigability. They say that they're getting too tired out by the day. Whatever work they do, they feel they're too tired, and then they have a dry mouth. They're not able to speak properly, and then the skin gets dry. As the sugar gets high, the mouth gets dry. So does also the skin gets dehydrated, and then you have itching and all those things. And then sometimes you may develop some wound accidentally, and but the wounds don't heal. So they are the early signs to tell you that the sugar that type 2 diabetes can lead. That's where to identify that you have type 2 diabetes. So about 90% of the people suffer from what we have. The entire population of the bulk of the population, as I said, that is only type 2 diabetes. And it was earlier called as non-insulin dependent diabetes. But over a period of time, people don't understand that once you exhaust your pancreas, the 50% which I told you is reserved, that is remaining. And even if the 50% is not being preserved by using by earlier intervention in terms of taking advice from the doctor, going for the test, and then not taking the proper medications on time, and then not following the lifestyle, because this is a lifestyle disease, then you can understand that you will have to use insulin early, even for type 2 diabetes, because we have something called what we call as the OHF failure. First and foremost, it's an inevitable diagnosis. It's diagnosed late. So whenever it's diagnosed, and anybody, as I told you, in the pre-diabetic phase or any other phase, when you just check and somebody says that you have diabetes, you should understand that before the diabetes could actually be detected, there was a phase called the pre-diabetic phase. And this pre-diabetic phase lasts for almost 6 years. The line which I mentioned on the day of neck just doesn't come in a day. It takes 6 years after the metabolic changes that happen within the system, and then you tend to develop diabetes. So keep it in mind that if you don't intervene early, then you are allowing the complication to set in, and then the progression of the disease. This is a very progressive disease, so you need to be careful. As I told you, it involves all the organs. So risk factors, definitely, as I told you, there's a family history, and among the young girls which we have, or those who are menstruating, and sometimes the cycles are not proper. This is an early way to find out among the girls that once they have reached the puberty, and then if they don't have proper cycles and they're trying to put on weight and they're gaining weight, young children, you'll be quite surprised to see they have the obesity and truncal obesity more around the abdomen, a lot of fat getting accumulated around the abdomen and around the shoulders. This signifies that there is a hormonal imbalance. This is a hormonal imbalance that says that the insulin cannot be used properly, and this is called as polycystic ovarian disease. This is among the young children, especially school-going age, who have already developed the puberty, whose cycles don't come in time, or those who are putting on weight very rapidly. So make sure that these children are identified early, so that we may be missing to identify the disease early, but this is where one of the hormone imbalance can lead to it. And of course, the race and age, the African American, Hispanic, and Asians. But unfortunately, Asian Indians, and we have a particular gene that can lead us to a problem at early OHA failures and OHA. For example, what is OHA failure? When we tell them is that you have been taking medication. Initially, the doctor would start with one pill, then goes on to second pill and the third pill and the fourth pill, and still your 3 months HbA1c in a year is not coming to the target level of for the age of 50 years and above, it should be 7.5, and below the age of 50 years, it should be less than 7. If you are not able to maintain this, then the complications set in early, and that's what we call as OHA failure. So this needs to be borne in mind when the doctor tells you that why insulin is required, why you medicines are not working on you. It is just a hit and trial method. When the patient don't understand, there have been a lot of studies which been following patients for 10 to 15 years to understand their quality of life, how when they were burdened with this disease, when they were diagnosed and they were followed on advice of the doctors, and their life was followed up for a period of 10 to 15 years. And those who did not take the advice, and they were also followed up for 10 to 15 years. And unfortunately, I will tell you, the ones who took the advice early, because they had the scientific evidence, and we had these scientific evidence helped them to get themselves checked up early, diagnose early, treat early, and the complications were not there, very less in fact. In fact, they had a very good quality of life. They were not homebound and they were suffering, no, but they had a very good quality of life. But those who did not take and then over a period of time develop complications, they are the ones who had to be hospitalized for a long period of time, and they started developing too many complications. The social life was disrupted. They could be only homebound. They needed assistance. So you see, so many factors come into play. It is not that one diabetic patient has so many inclusions to be taken care of. In terms, it also impacts this is the only disease that is eating into the GDP of almost all the countries, more so in US and Europe and in India. So we have a huge population at stake. So we need to identify early and treat. So gestational diabetes, as I told you, because pregnancy is a stressful state, I will not go more into details of it. But here the data, as I said, there's a definitely family history, or the person is overweight even before the pregnancy starts. So these are the way by which they can develop type 2 diabetes, and they can be put at risk of developing this. And sometimes you have what we call especially diabetic patients who have not been having the sugars under control and have given birth to big babies, which we call as macrosomia babies, because these children, because of the excessive amount of sugar in the mother's blood, these children tend to drink a lot of water. So because of excess drinking of the water, the baby bloats up, and this is called a macrosomia, and that's why the normal delivery is very difficult to be done, because the head and the body size become too big to come out through the passage. So this is one of the things that you need to remember. And 18 out of every 100 pregnant females will develop GDM. So we need to be careful, understand that before going in for planning for pregnancy, make sure that you need to get screened for obesity earlier, and then if it is there, then you need to go about so that you don't develop any complications during pregnancy. So as I already told you, there are many complications. It affects all the organs. It can it can affect your eyes, kidneys, and lungs, and your every part of the body can lead to this sort of this. More it becomes friendly with them. And unfortunately, because this is inevitable late diagnosis, and there's a delay in taking treatment, because we have certain barriers in understanding them. For example, once you tell the patient that he has diabetes, the biggest barrier that comes into play is his own willpower. He said, no, it cannot be. Either he blames it on something else, even if it shows medical evidence that he has diabetes, he will not accept the fact because the power of will barrier is so strong that he doesn't want to accept the fact that it has happened to him. And then he keeps blaming it. And then I have done a small study on that front to see why, despite of the fact of having the best medical knowledge and having the best evidence available to tell from your body what is wrong, and still people do not want to accept it and try the alternative methods. So in this way, I was able to map the journey of some people. There was one example of a person who came to me and I told him that this is what diabetes is happening to you. You have been already diagnosed, you've already missed the pre-diabetic phase, and now you will be developing some complications on the way. So make sure that you start the treatment early. I gave him a good deal about lifestyle management and all that, but unfortunately, the patient didn't turn up to me, and I told him exclusively how the organs will get involved. But unfortunately, I missed the bus with that guy. He didn't come back to me. He came back to me after 3 years, and unfortunately, he had his foot amputated. So that was the tragedy of life. Because I asked him, when I mapped this journey, I asked him, okay, what happened after you met me, and then where did you go? He said, no, I thought, I better go and find out from somewhere other. So I tried the lab first. I thought this lab is not good because somebody commented that the other lab is good. I did that. In there also, there was some discrepancy. Then unfortunately, I went to my closest friend. I asked him what the qualification of friend. He's a Kirana store guy. I said, then what happened? He said, no, somebody has done something to you because we're spiritually bonded country and we have a lot of beliefs and among this. So he said, somebody has done something in your family, and this man went on to meet a spiritual guru. And over a period of time, the advice on the based on the see, look how the passage of time has caused this complication to go so deep to take his foot off. So then after that, then he said, after that, things became so bad. I was not getting well. Then I went to the doctor finally, and the doctor said it's too late and I need to operate. So you can imagine this, the travesty of time which we have, and based in early diagnosis, early understanding. So seek knowledge from the right source. Go to the right people who have knowledge about this. Just do not go, because now see, everything is so specific. You have cardiologists, you have nephrologists, you have neurologists, you have internal medicine guys, because we are placed in a better position to understand this disease than anybody else. You will be surprised in the United States, no endocrinologist will be treating diabetes. It is the only MD physician that treat diabetes. So I will tell you one by one how the organs will get involved. So be sure that the main common thing here is uncontrolled diabetes leading to all sorts of ailments that can happen. You can develop an early stroke, you can develop early heart attack, especially so in the Asian Indian group, because we carry a gene called as the thrifty gene. This predisposes us to early heart attacks. We do not know the reason why, but most of the diabetes patients, especially in India, die young because of heart attacks. So now, how to monitor and how to go about, and what are the parameters that are used to judge whether you have diabetes or not. So we have certain tests now. The things are very convenient in terms we have this glucometers. But you need to check the batteries, you need to check the strips, whether they're outdated or not, before you do it on somebody or do it on yourself and then conclude that you already have diabetes. Sometimes you may get misreadings. So be careful that this could be some technical snitches that could be there with the device. But the best way would be to go with the vein blood, and so there you will be able to diagnose early. You can do an overnight fasting of the 10 to 12 hours, and the cutoff ratio for those people over. You need to understand that the kits have been standardized in the lab. So when you do the test, the kits have certain recommendation that the fasting should be on this particular level. So minimum 10 to 12 hours of overnight fasting from the last meal which you take is so important to give you the correct diagnosis. And then what should be the target level for a fasting blood sugar? I'm telling you the latest norms. The latest norms for all Asian Indians and everybody around the globe is 80 to 126 milligram per DL. This is what the range should be in the fasting level of overnight fasting of 10 to 12 hours. Sometimes people have the habit of snacking in between in the middle of the night. They need not calculate from there. They need to calculate from the meal. That is important. So the dinner which they have the meal, from there they need to calculate 10 to 12 hours. The next is the postprandial blood sugar. That is diagnosed once you have your breakfast, and from there it is actually 1 to 1.5 hours. But for some complexity of the situation, because people may not be able to reach out to the labs, so they do it what we call as 2 hours, and there's a lapse time they given, but actually the text says that it is 1 to 1.5 hours, and the target level for that period is for the postprandial sugar should be anywhere between 80 to 160. So milligram per dl, this is important. And then what is called as random blood sugar. Randomly you check, and people are confused that what is random blood sugar. Random blood sugar is nothing but after you have your breakfast, calculate 2 hours from your breakfast time. Anything that crosses 2 hours after your breakfast and you do it any part of the day, that is called as random. But there's a rider for that. The rider is that, suppose if you have taken a calorie related food, for example, you have taken any solid item like a cake or a biscuit or a sandwich or a carrot or something, any solid item, then you need to wait for 2 hours to record your random again. Immediately after taking a solid item, you cannot record. So you need to give 2 hours to record your random blood sugar if you have taken or consumed a calorie related solid item. But if you have been on liquids only, for example, you have just had a juice or you had soup or you had water or you had tea, coffee, you can check it up anytime for random. But only the rider here is that you need to, if you're taking a solid calorie related item, then you need to wait for minimum 2 hours. So, as of now, for type 1 diabetes, there's nothing to prevent it. It's only God's mercy, and pray that, nobody develops it, because the kids, the amount of suffering which we have go through, enormous strain on the parents, enormous ones, the whole family is so disturbed, especially so the parents. It's an unimaginable deal. Can you imagine a small child being told that, there is no medicine for you? The only thing is an injection that needs to be pricked for you 3 to 4, 5 to 6 times in a day. Unimaginable. That agony and the pain of going through and guiding those children and the parents is so much of a task you cannot even imagine. I pray and hope to God that nobody develop these diseases, and especially so for the children. It is so much of a stress. Can you imagine? I had a child who was diagnosed with type 1 diabetes, and going to the school of, he was in second or third standard, and imagine the way he used to run away from his mother. The moment the sight of his mother was so painful for him, he started running from her. And the mother was so painful that, my son is getting detached from me. And when she goes to the school to put in the insulin at that particular time, he runs in the school, he hides in the benches. Can you imagine the amount of trauma the child goes through? But unfortunately, this is what the cure is so far. So if you don't give insulin, they will not be able to. This is a lifelong treatment. So you can imagine that how difficult it is for type 1 diabetes. So there is nothing to identify exactly. As you said, there are some genetic studies that have been done still in the womb, and the child is in the womb. They're taking the amniotic fluid, and they're doing some studies and to prognostic to say that in the future that the child is capable of developing diabetes or not. And there are some stem cells and all those things which are, I'm sure it's a long story with all those things, but they're still at all the research levels. But I think it's enough to understand that type 1 diabetes needs to maintain the sugar, because they are because these sugars fluctuate a lot, and the excretion that take place can cause a lot of oxidative stress, and they need to monitor the sugars very well. And in fact, we have wonderful devices now, and they need to maintain a very healthy lifestyle. And of course, as I told you, the stem cell are on research that we can transplant, but so far no success. But this research is on. So for type 2 diabetes, very important thing is that you need to understand how you can go about preventing this disease. Is that, for me, if you ask me, the most simplest thing which you need to do is to prevent is to make your lifestyle introspect on yourself and understand what your lifestyle, how it is going about. Are we becoming the slaves of our own luxuries? Are we trying to do too much of things which are not within our foray of performing? Are we overriding our vehicle for a long period of time, not thinking that something is going wrong with it? So I think this is the time to wake up. This is a wake up call. I'm telling you from now, the postulation which has been done in 2025, every household in India will have nothing less than 1 to 2 diabetes. So this is the postulation done by the International Diabetic Federation. So I'm at a loss to understand how to go about. How are we going to go about in screening these children? But unfortunately, in India, even if you have it, they will not tell you that they have it, and they will be suffering at the cost of somebody else's hospitality. In terms that if somebody offers them sweet, they don't have the guts to tell them, yes, I have this disease, I cannot. You should not allow your vehicle to be used by somebody else. Make sure that you tell them upfront that you have this disease. And then you can go on in guiding those people by saying, you will be saving one more life by giving knowledge to them by saying that, yes, this is this disease I'm having, this is what it can do, And if you diagnose early, this is what's going to help you. So this is just a simple conversation among friends. There are a lot of people I'm sure will understand this problem, but people hide the things, and they, because of their hiding, not telling anybody, they don't get help at the right time, and they develop complications early. And not only that, how do you go about in telling your own family members to be screened? When you say that you love your family so much, why do you hide the disease from them? Is it emotionally that they will be disturbed? Yes, for a woman, anybody would be disturbed, but that's not going to do any harm. What is going to do harm is that not approaching it correctly, not getting it diagnosed early, not following the right modality of treatment early. This is going to have a toll. Imagine you are the same early member of the family and you have hidden this disease, didn't take any help, and kept on suffering mentally, morally, and and then you unfortunately, God forbid, for some reason, some complication comes in and you go away. You can imagine the burden on the family. It's too huge. They're suddenly taken for a loss that they don't know how to go about in living further. So I'm telling you that help everybody so that to diagnose the disease early, it just takes little time. Just to talk to my. You don't have to say, as I told you, first identify the sign and tell me the symptoms. I'm sure you have done a wonderful job, which no matter of marketing in the world through our holdings you'll be able to do, but you will do a wonderful job to save one life. It's not our life only. We don't live for ourselves. Our life is all about living with people whom God has blessed to live in a community, in harmony. So that's what is important. So make sure that you guide people exactly how to go about. So for me to prevent this disease from happening, I would put it as this. Most important thing is sleep. The 7 hours of sleep is so important that nothing in the world can buy that. If you have, you're blessed. 7 hours of uninterrupted sleep in the night is so important because that's where the repairing happens in the night. So that's where those chemicals are released to repair your body. So it is so important that you make sure that you get an adequate sleep of 7 hours. Even if you're not getting sleep, please take guidance from the doctors. See, sleeping pills, there are many people get confused that if you give a sleeping pill, oh, I may get addicted over a period of time. There's a difference between sleeping pills. Now, suppose if I give a medicine for cold and cough and you tend to get sleep, why is that? Does that mean that this medicine is for sleep? No, it's not. It's not a sleeping pill, but it has an action that induces sleep. Likewise, there are medicines that give very tranquil feeling to the brain and they cause to maintain your natural sleep cycle. At least for some time, you need to take it to stabilize your sleep. So you need to take medicines for a short period of time. You may not get addicted to it. There's nothing like that. And God forbid, for some reason, even if you got addicted to it, but the plus points are so many. If you get a proper sleep of 7 hours, you're not allowing the release of those bad chemicals to happen. When those bad chemicals are not released, the complications are not happening. Can you imagine? It's worth taking it rather than suffering from the complication and going through your time and suffering from it all the way. That's a huge burden on yourself. This just a pill, it doesn't make any difference because there's no complication that has been found. In fact, sleep has become a boon now. You need to have 7 hours of sleep. Make sure there are some people who say that they cannot get sleep properly. So I would tell them that better to exercise a little early in the evening so that you need to tire your body. Look at the workers on the road. They work so hard and ultimately they sleep in different positions. You can't even imagine. Look at the rickshaw pullers. Look at the people who, do the plumbing or hard work on the roads and all those things. They just sleep anyway. Okay, but you need to make sure that you need to tire your body and have your food on time. Timing is so important. So make sure that you sleep for 7 hours. That's a prerequisite to maintain or control this disease or prevent this disease from happening. So that's also a possibility. So the next most important thing is that exercise. Exercise is an inherent thing that we do. Everything in the world is revolving. The earth is revolving. Everything is in movement. So make sure that you need to move your sugars. You can move your sugars from your bloodstream to the periphery. Can you imagine the most fastest insulin in the world, glucagon, will take 30 minutes to act once I inject into the body. And then after 30 minutes of action, it moves the glucose from the bloodstream to the periphery, to the organs. But if you walk, it takes only 30 seconds for the sugar from the blood to turn into fuel to the muscle. There's nothing better than this, I'm telling you. So make sure that you need to walk, but enjoy what you're doing. The actual requisite is only 3 kilometers or 30 minutes is the actual requisition that has been made by the American Heart Association. Either you walk, you run, you jog, but 3 kilometers and 30 minutes is what the body can take it. Anything beyond that, trying to stress your body, trying to do the things which others do. I will do something more better than him, and I will like to, get his abs. And no, it's not possible. You need to have a judgment of your own. This one. Unfortunately, if you look at the early morning walkers, you'll be surprised to see not a single expression of happiness on the face. It looks like the doctor's prescription is stuck on their face. They're not happy in what they're doing. So I want you to enjoy what you're doing. Let those hormones come into play. Let those beautiful chemicals within the system, they are the ones who are going to repair your body from within yourself. So let them come into play, and that can happen only when you come into the environment of nature. Take those healthy vibrations, take those inputs, your vision through the nature, and then enjoy what you're doing. So exercise need to be done. People who are not capable of performing exercises, people who are too obese, people who have got arthritis, people who have got frozen shoulders, who cannot perform. But I'm telling you, we need to find, don't leave your parents who are old, who are not able to do, don't force them on things, but be very friendly with them to make them understand that we need to find ability within your own disability. That is so important. It's not helplessness. It's only that our attitude towards their helplessness and our empathy that makes them not do anything. If you tell them lovingly, are you not breathing? Yes, you are breathing. Then, Dad, why don't you use those exercises for breathing? That also is an exercise. Are you sitting? Yes. Can you not move your hands by just moving and simple rolling and putting up and down? You can do all that. So we need to find ability with your own disability. The only thing is that we have prejudiced mind. We don't understand the human power, the brain. The human brain is so beautiful. It can perform miracles. So make sure that we help people to find ability within their own disability. There's nothing that cannot be done. But God's help, you can. If you do the right knowledge and help the people with the right intention, that will definitely work. And then, of course, you need to, diet per se is so important. People are of the belief that if I eat sugar only, I will develop diabetes. It is not so. Everything taken in moderation, whatever God has given in providence by nature, will never kill you, will never cause you to have this disease. What you eat will not kill you. What eats you will kill you, and that is the stress. So eat without guilt, but eat in moderation. What is required? You know that you have a condition like this, so you need to know the things that can increase the sugar levels in the blood, especially for the simple sugars, and sweet items and chocolates, and then high concentrated sugar drinks. They are all capable of doing it, and those juices, even fruits do have this one. But if you're using those juices also in excess amount, anything that is in excess is going to elevate your sugar levels. So already those who are diagnosed with diabetes, make sure that they follow a very good pattern of eating healthy food. And the recommendation that have been made is that what are the things they can take to avoid putting on weight indirectly, then developing on diabetes because of insulin resistance. So most importantly, you need to be aware of two important things which I like, because there's a whole list of things which I'll not be able to cover in this span of time. But I would love to tell you that the thing that is destroying us, especially our children and our families, is gluten. Please make sure that you have gluten minus foods. The wheat which you are eating has been imported from north. It was not there with the south. Our ancestors never ate that. Our ancestors ate only jawari roti, baja roti, and they had millets and they had rice. They were all rice eaters. But they never went on to develop this disease because they had a very happy living. They were used to exercise, they used to travel, they used to walk for long distance. But here, unfortunately, in India, everything is at the press of a button. Even if you want to get the remote from there, you will ask somebody else to give it to you, but you will never walk up to take the remote. So, those are the things which you need to understand, that exercise is so important for the body, that you need to move every part of your body, and then you will be able to control all these ailments. And most important thing which I wanted to tell you about the food is gluten. Please avoid it. Wheat contains high amount of gluten, but there is simple formula by which you can reduce the gluten of that particular food content. For example, how we will be able to reduce the glycemic index of certain foods. For example, people say that if I eat methi, my sugar comes under control. If I eat jamun, my sugar comes under control. If I take a karela, it comes under control. Why is it? How does it happen? The phenomenon is very simple. If you're eating a sweet and you put salt in it, it changes the flavor. So this is just change of flavor for a transient period of time. It doesn't cure you of your illness. This is the next day when you check, the sugar is still there. So people are getting confused with the thought that if I take this, it will be kept under balance, under control. But make sure that it's pesticide ridden. And the best way to wash off your vegetables is that you need to use vinegar. Just take a tablespoon of vinegar, add it to the water, and put the vegetables and fruits and wash it. This is the best way you'll be able to remove any pesticide or any chemical that is coming into the fruits and vegetables that can destroy your kidneys, because pesticides are known to do that. So make sure that how beautifully you can, how simply you can do this. Just have to add vinegar in a bowl of water, and then wash your vegetables and fruits, and then keep them in the fridge as you want to consume. So gluten-rich food need to be avoided. Even oats contain a lot of gluten. People are not aware of it because they keep eating oats and they say, "Oh, I'm eating oats, so my weight will be under check." No, it's not so. Weight under check is only when you have a proper sleep. Because if you don't get proper sleep, you're releasing a hormone called cortisol. This is the weight increasing hormone. It will put a lot of fat around your belly. It will increase the fluid intake in your body. It will retain the fluid in your body and thereby cause increasing weight. So make sure that you don't allow this particular hormone to come into play. And the next important thing, as I told you, that eat what is being produced from your side. Go to the seasonal things that are happening. Just venture once in a while in the right to Badla to see what is the produce of that particular season. Fruits that are there, vegetables that are there, sprouts that are there. See what is grown within our oil. Our survival is based on the soil which we live in and the produce of that particular soil. Nothing is going to matter. You cannot say that I'm eating grapes from California and that's going to improve my immune system. No. What is going to improve your immune system is that you have a handful of peanuts from your soil. That is what is going to make you more healthier than a few grapes and most expensive grapes from California. They won't do any good to you. Please believe the fact that where your existence is there, that's where you need to be in co-symbiosis with them. Can you imagine that sometimes when you eat food every day, how is the food getting digested every day? Because we need to have a balance of the good and the bad bacteria in the gut. And this is what the prerequisite for our immune system. This is the main gateway. People fail to understand. I used to travel a lot around the globe for my conferences and my lectures, and I used to face one particular problem. The moment I eat their food, and immediately my stomach gets upset. I used to be at a loss. Why is this happening? This thing, the same bread I ate in India, the same bread I'm eating here, same egg I ate there, and the same egg I'm eating here. Why is this happening? This made me to contemplate and do a lot of research work on that, and I would like to share this with everybody so that you will be able to benefit out of this. See, the whole body is based on what we have, the balance of the good and the bad bacteria. The soil on which we live in, every day I'm interacting with those viruses and bacteria. The curd which I have, see, by nature has given providence only for two important three and probiotics that are available. One is the yogurt, and the other is the Italy, the South Indian Italy. Yes, the South Indian Italy. They are rich in natural pre and probiotics. So make sure that you have it at least once or twice a week. And curd every day. The curd which is set outside and then used by the morning you set it and consume it by afternoon or evening. Not the overnight fermented curd. That's not going to help you. So because it is very sour and not very easy to digest. So make sure that So what I used to do is then I realized that what is helping me was all this because I don't have the same pre and probiotics which are there. So when I made it a point, by God's grace, when I landed in any of the airports, first I used to have the local curd. And believe me, it worked like a miracle. And whatever food they had to offer from their place, and I never got any problem from then on. So I would like you to share this so that you will able to pass on this message to your people who are traveling very often, and they may get upset if they're not able to have this. So gestational diabetes I've already covered, and the most important thing which I would like to elicit now among the diet also, especially so I would I would tell people not to consume the sugar-free tablets or the sugar-free abstracts, whichever there is the sugar-free, this sugar-free, that sugar-free, organic, sugar-free, chemical. I would request you not to go about with that because none of the guidelines in the world mention that, because where I did my research facility in the US, there was a time when the presidency was at stake. The presidency was at stake because they wanted to remove the aspartame. So when the Senate took it up into this one for telling that there's a paper that came that aspartame can lead to prostate cancers, but unfortunately the outcry among the people was so because the people got so used to that aspartame, and in fact the people came out in the streets, protesting against it. So to save the presidency at that time, the government had to give in way. But believe me, the research papers clearly mention that no, you should not take. If you want to take, especially for diabetic patients, you want to consume consume in little. For example, you have seen this Indian Bollywood movies and all. You say the chutki var sindoor. I'm sure for diabetes patients that's more than enough. So natural sugar, whatever it is, if you are addicted to tea and coffee, make sure that you put just 2 chutki of sugars. That should help you. And I'm sure that this is the only way we'll be able to control the sugar levels in our body. Of course, primary prevention for type 2 diabetes, as you said, you need to reduce your weight and you need to keep your BMI less than 25. Actually, the Indian Asian cutoff is around 23.6. So make sure that you know the BMI calculated height and weight. And this one, you have many calculators, anybody can do that. So you will be able to know whether you come into the obesity class, you don't come into the obesity class. And the global prevalence is a huge challenge. I told you, it's eating up the GDP of all this one. And you see where we are standing around 69.2 million, and we are not far away from China. I'm sure in the next 2 years, though China have taken some strong this one, I'm only worried for the next generation because they're at a total loss, and you need to take the right guidance to go about in this one. So how to go about and all those things, and I would definitely like to tell you that there are some people who are getting carried away with the fact that they know too much. You can be a student of Dr. Google, but you cannot be Dr. I'm telling you, because we come from learning from the dead to the living. Just to understand the hand of a dead body sitting in the mortuary and dissecting it every day, it takes 3 months. Can you imagine? So don't you feel that this is the right person to go and approach and take help? People, I don't know, for some reason don't value blood. They're getting too attracted by the diagnostic appeals. People say whole body checkup. I'm still at a loss. 18 years of my practice so far, I've still not understood how the miracle of God works. I have not fully understood the system as yet. But how is it possible that diagnostics have understood? 24 tests, 30 tests, unnecessarily exposing yourself with the X-rays. No, I want to get the whole thing screened. What is the logic? Do you know how important your blood is? Do you go to any civilized country in the world? I get people who come here from IT companies and all those things, and they do all the tests and come back. I said, why? Why did you fall prey to this? Did you ever do one thing simple which I want to know? Nobody does that. Please do your homework because the next generation is going to be at a total loss. The next generation, the kids are going to suffer a lot because they are going to Google everything. They are going to know what test to do, and they are going to go and ultimately they will land up not with the doctors per se. They will be getting more of it's a boom practice for the psychiatrist because they will be at a loss, confused, don't know where to go about, how to go about with them. This is what information they have wrong from the wrong source. So my simple appeal to everybody, please take the advice of the doctor because he knows. Do you know what the specificity of your blood, what is the specificity of that particular test is? Without even telling the symptoms, everything is done. How is it possible that everything is done? You have not even heard any symptom and you have just given your blood for nothing at all. You know how much it takes for 10 ml of the blood to be given? 120 days. Mark my words. God forbid, if you have given too many ampoules without consulting, and then at that time your immune is low and you're attacked by some particular seasonal virus or this one, it can be catastrophic for you. So please, without the advice of the doctor, don't come to the people who have knowledge. Please talk to them. Tell them you are this one. It is so important. And my simple request is to everybody. We know when we are born, when the child is born, everybody says that, oh, look at his face, it looks like his father's face. Look at his ear, it looks like his mother. His eyes look like it. So these are genetic imprints that are already there. So we are also bound to get these particular diseases over a period of time. But a wise person is one who will always hold the umbrella, not only for himself, but also for his family members. Now, how to go about with that? Very simple thing I want you to do. I want to appeal to all your parents and all the people. Make sure that before handing the property papers to every child whom we have amassed over a period of time, worked hard and got this asset, and now you're transferring the property to your children, please forward one pedigree along with that, a family health tree along with that, the property papers, so that the children will know that their parents had this problem and they will know when to seek help and how to go about. So that's the most wisest thing anybody can do. So just draw your family health tree because genetically, I'm not too sure about the other diseases that can creep in, but I know genetically there are certain things that are going to happen for sure. There's no two ways about it. So make sure that you take the right guidance. Please draw the family health tree, then guide your children. That once the children are guided, then they will know that they will have the best prevention programs, which they will be telling the kitchens in the future that not to produce this thing because we suffer, our family has this genetic predisposition for developing this particular disease. So I'm sure this will go a long way. I have already started my initiative in terms. I have started a program for the young generation. I go to the schools and imbibe knowledge and skills among them. So my belief is that I would love to create one health ambassador in every home, and that will be the most responsible person to understand how to go about. So that's where I'm trying to use my knowledge. That's, as Swami Vivekananda said, wisdom is not about accumulating your knowledge; it is the effectiveness in how you use it. So that is what is going to pay a long way. So I wish everyone, happy Ugadi. The festival is coming. Please enjoy. And any questions you have, please, I will be ready to take it. Thank you so much.
Thank you so much, Doctor. Thank you so much for some great insights with diabetes, and especially the last topic you touched upon, that is handing over the family tree, the family pedigree of having diseases, and educating kids about that. I think it'll make a huge difference for the generations that are coming in. Thank you so much. So we have a poll that I'm launching. Please, everyone who are present here, to take the poll and give us some feedback on the session, so that we'll know where we are going wrong, and we'll make necessary arrangements to get everything right on the next one. And Doctor, we'll move on to the Q&A session. So we will have some questions coming in at us. People who wants to ask some questions can raise your hand and also put your questions in the chat box. I'll ask Doctor these questions. Okay. So, Doctor, we have a couple of hands raised. We'll take the first question from Moin Akhtar. Moin Akhtar, if you can hear me, you can unmute yourself and ask your question.
Hi, doctor.
Yes,
Is
sir. Tell
diabetes
me.
is reversible because so many people, so many pharmaceuticals and herbal and Ayurveda people are claiming that they is can be reversible.
I think your voice is breaking. I didn't get it clear.
Dr. Moin is asking if diabetes is reversible, because a lot of pharmacy companies, a lot of other doctors and other practitioners are claiming that the diabetes is reversible. He's asking whether everything that is being said is true.
Yeah, see, basically, as per what the research says, that it can happen only if it is the first decade. For example, if you have just been pre-diabetic, you see, you have certain ranges by which can govern you and tell you that you like well, the HbA1c which you have. So suppose your HbA1c around 5.5 and gone on to 5.6, 5.7, 5.8, till 6, it's okay. Okay, then there are chances of reversing the process. But eventually, if the gene has to decode during your stress time, eventually it will come. You may be able to hold the disease for some time. You may be able to reverse it for some time. But there's nothing like complete reversion. There's nothing like that. If your genes are very strong enough, suppose if you have two parental histories, both the parents have a very strong genetic history of having diabetes, I'm sure the child is going to get it. There's some other theory also where there's a skip generation theory. The parents may have it, the grandparents may have it, the parents may not have it, but the grandchildren will have it. So it is very difficult to say that you can reverse the entire process. Yes, there is a way by which, if you are identified in this particular stage of time with the HbA1c is around 5.5, 5.6, or up to 6, you will be able to prevent it from happening for the next 5 years. There are a lot of studies done on that also. There was a DDANG study that was done in China, which was only basically on lifestyle. They didn't give any medications. They identified the people who had the disease with the pre-diabetic, this one, and they followed them for 3 years. Almost around 6,000 participations were there. But the study was so rigid and so stringent. It was like the Shaolin temple. People had gone into the Shaolin temple. So that was the thing. But many people dropped out of the study. So out of the 6,000, only 3,000 remained. Even out of 3,000, the rest remained was 1,500 only. And that study proved that those people who had followed extremely good lifestyle and in the pre-diabetic phase never went on to develop diabetes. So this was one such beautiful study. So it is possible, as I told you, but if it is done in this particular phase.
Thank you so much, Doctor, for that answer. We'll take the next question from the chat box. It's from Sachin Nair. It says, is it true that Big Pharma has been lobbying to get the diabetes sugar level benchmarks so low that everyone shows up as diabetic? Apparently, the lower limit for fasting was 140 about 20 odd years ago.
See, I'm not an authority, but I have been there in US and I have seen the stringent, calls taken by the American drug pharma and all those sort of things. But I do not know how the things go about behind the scene. But yes, of course, there have been certain medications that have been come into the market, on a fast sale track record to sell them off early. But later on, then they found that this can lead to this complication, and the drugs were taken off the shelf, and the company had to pay huge losses. But nobody was left; no culprits were left just like that. But pharma companies don't decide the guidelines. The guidelines are decided by the American Diabetic Association, which is a big body. Then you have the European Association of Studies in Diabetes. Then you have the International Diabetic Federation. Then you have the WHO. So these people define the thing. It goes on from region to region. For example, I may be having a BMI that was only around 23 or 20, say, but for a patient of from Europe and America, they have a diabetes when it starts when they have a BMI of 30. Though I am a lean guy, but still I go on to develop diabetes. But imagine a guy who is only 33, and if I go far east, my mind is still small. But still he also goes on to develop diabetes. So the logic here is that we need to understand that somewhere down the line, we will be able to control it to some extent. But the guidelines comes from the consensus of so many patients. It is almost around 10,000, 15,000, 20,000. Then only we get that range. It is not just given up randomly. Nobody can influence those bodies together. You can influence one body. Then we have different guidelines. We have the Canadian guidelines. We have the American guidelines. We have the European guidelines. But all are speaking in one language only. The parameters were to be changed because make sure that the patient will miss the pre-diabetic phase. These people are not able to understand. They are saying that they are reducing it just like that as the will and wish. No, it is the consensus that comes from the pouring in data from each country comes into play, and there's a sharing of the data among the top bodies, and that's how we come to conclusion that this has to be dropped to this level. Some people mischievely, especially the reporters, for no reason at all, they want to create some some big news, big bang news, and then they catch hold of some professors and tell them that this is possible. Too many things are possible. This is an imperfect science. You need to understand that. This is an imperfect science. So it has been done only to identify those patients who are being missing. Many people are at a loss. You tell me when do you get your test done? Unless and until you have met with an accident. So the logic is, if you prime the people little early, then they will know. There's nothing like benchmark. Everybody has, for Asian Indians, cutoffs are different. For the Americans are different. They have a different BMI. So it's nothing that they can influence us. We in India use our clinical sense because we are more acquainted with the patient than anybody else. The amount of exposure we have, I don't think in the West and anybody in the world can have that much of experience which the Indian doctors have, because we see so many number of cases. And our judgments are not based on what the guidelines are only to guide you. But what you need to understand is the epidemiology for your own people which you're living with. Their patterns are different, their behaviors are different, the approach to things are different. So we take into our own judgment that overall consensus in India, so this is how it is. So nobody can influence us. Guidelines only to guide. They will use certain parameters. But it doesn't mean that we start everybody taking in the same thing. There are people who had HbA1c abnormal, but if you do their fasting and the post-run, they are normal. That is because the HbA1c machines are not standardized everywhere. Not everybody is using the same machine.
Okay, thank you so much, Doctor, for answering that question. We'll take another live question from Mr. Arun Vishwanath. Arun, if you can hear me, you can unmute yourself and ask your question.
Yeah, so can diabetes be cured? Because there are a lot of ads claiming that diabetes can be cured, especially type 2 diabetes. So how is it true that it can be cured completely, and what is the success? Thank you.
Actually, I'm telling you, I already told you about the DDAC study. See, there is nothing like you can cure this disease. Absolutely no. Once it has decoded, it is to stay, it is to be with you. Okay. What we can do is control it. As of now, whatever knowledge we have, whatever the research that has been done on humans, we know that it can only be controlled. It cannot be cured totally, not at all. What you can do is prevent it. Now, you tell me there were some people who did not, when they had that pre-diabetic phase, and at that time, when they did not develop any diabetes or nothing over a period of time, and they could reverse the diabetes. Okay, they reversed the diabetes also and kept their HbA1c less than 5.5. But 5 years down the line, 10 years down the line, the environmental factors, the stresses of life, they went on to develop. So if you're not going to, if it's not that if you have reversed it once, you are safe free and you can maintain a different lifestyle. No, it's not that. The lifestyle has to be consistent. Then only you will be able to prevent it from this one. You can prevent the complication from setting in early if you have identified early, but you cannot cure it. As of now, maybe God has kept the knowledge somewhere. There's a lot of research is going on, but whatever knowledge we have so far is only to control the disease. There's nothing that can cure you of it.
Thank you so much for the doctor. We'll take the next question from Shankar Ganesh. Shankar Ganesh, if you can hear me, you can ask your question.
Thanks for giving me opportunity to ask the question. Thanks, doctor, for your session. It's very helpful. And I have 3 diabetics patients in my home, and my father, both my parents, right? My father and mother are diabetes, and they are taking the medicine. And my wife also in pre-diabetes stage. And I do see like how the cycle goes. Okay, that my one question, right? What I hear, there is a the Indian rice, right? The brown rice. The people who continually eat that, I see that the diabetes level, blood glucose level gets reduced, and it's pretty much under control. And even we tried out that it works well for us, and also we followed intermittent diet actually. So 16 into 8 hours, right? Morning 10 o'clock we have a food, and then 6 o'clock in the evening. And I do see like there is a it helps a lot in very large extent actually. So how do you think that we can follow this practice for rest of the period with the moderate exercise like walking and other exercise, or what your suggestion?
See, basically, as you said, that you have a very sweet family. So
Yeah.
you
Thanks, Doc.
so you have just on joke side. I wish and pray that by God they remain safe and healthy. But the thing is that what we need to understand over here is that so no matter the pattern of what we eat, see whatever food we eat, they have one thing what we call as a marker which you take as a glycemic index. You see,
Yes, sir.
if you eat a food that has proteins, don't have carbohydrates. So if you eat chapati, it is not, but they have a glycemic index. Some amount of sweetness is there in that. You understand?
Yes.
So brown rice has the lowest glycemic index. So that's why your sugars don't fluctuate. Okay.
Okay, sir.
Then the next best thing is the basmati rice. Basmati rice. The
Yep.
most cheapest of the basmati. You don't have to buy the most expensive to get your sugars down. It will be an expensive affair already. The burden of the pill. So what you need to do with the basmati rice, you need to wash it 4 times and then cook it. Any rice that is taken without the starch, the sugars will be normal. So
Okay,
you
sir.
need to strain. People who are cooking in the cookers and eating it with this one now, because starch contains too much of calories. So the
Yep.
glycemic index of each particular food is there. So the lesser the glycemic index, the sugars will not fluctuate. But it has to coordinate with other aspects of food also. Suppose in a day you are taking too many carbs, you need to measure your carbs. You may have one carb which is coming in this form of rice, then the other carbs that are coming in other forms of this one, like you have in the wheat, you have it in this, so in the fruits and all those things. So how are you going to go about with that? So this may help you to sustain it. I'm not denying it, but what you need to do is that you need to take it what you call in moderation. Intermittent fasting is good enough. But it doesn't suit everybody. For example, I will tell you a very simple thing. Just apply this logic. When we were born, our mothers used to feed us every 1 hour. And when we used to cry, they used to overfeed us. Okay. And that pattern has been set to a 3-time meal pattern. So the brain has accepted that fact that 15 years down the lane, 20 years down the lane, the brain is going to behave in the same way. Exactly the same time, the brain is going to allow the stomach to put in the acid in the stomach. So this intermittent fasting may be good for some. Some may not be able to accept it. They may develop acidity, or some people will have some other problem, or they may have bloating, they may have gases and all those sort of things. So it is good in a way. But what we are trying to tell you is that eat everything in moderation, eat on time. Timing is important. Our time, we were destined to have this particular time because our mothers fed us in this particular pattern. So timing is important. And if you take, there are people who have been eating like this 3-time meal pattern and taking what has been advised, their sugars are normal. So it is not that if I The biggest problem here is that's why I will tell my diabetes patient not to do the post-run blood sugar, because if you eat anything, you don't have that insulin reserve to bring your sugar down immediately, and they get panicky. For me, the worst thing is that my diabetic patient getting panic about his sugar levels going up, because that is only transient. They don't seem to understand that this phenomenon is transient because they don't have the insulin reserve like a normal person. For the normal person, moment he eats, the information goes from the stomach. So much of sugar has come. The information is passed to the brain. The brain will immediately tell the pancreas, shoot, and they will shoot the sugar to the rooftop, the insulin to the rooftop. Then after the food gets digested after 2 hours, and whatever the calories that are being produced, the glucose that is coming, within 1 to 1.5 hours, it is brought down because the insulin reserve is so much. But that's the case with the diabetes patient. And then they have the guilt factor. I ate this. That's why it has happened. I should not have eaten. They try to become too troublesome for themselves. So when you do that, you're allowing the more bad chemicals to come into play. That is a stress hormone.
Yes, sir. Thanks, sir. Actually, I have one more question. See, actually, how this, the fatty liver and the pressure, blood pressure, and all this, is there any connection with the blood glucose?
Yeah, of course. See, we have what we call as a metabolic syndrome, actually. This is the conglomerate of many things that are happening within the system. The waist tube ratio, somebody just asked in this one that, we measure the waist tube ratio. For the male, the pattern of waist tube ratio, you need to just take a simple tape and measure it and keep it around your belly button. And the ratio for the 90 centimeters is what should be there for the male. Anything going beyond 90 centimeters is what he's granted himself with the metabolic syndrome. So metabolic syndrome is that he will have high levels of triglycerides in his blood, that is high cholesterol. He will have blood pressure, and he will have this waist tube ratio, which is 90 centimeters. So he is a candidate for metabolic syndrome. For the females, the pattern is a little different. They give 85 centimeters is the cutoff for them. Anything going beyond 85. And what should be normal pressure? The upper limit can be anywhere between 100 to 130. The lower limit can be anywhere between 70 to 80. So 130 by 80 is a norm. Anything going about that, then the patient is landed into the conglomerate of metabolic syndrome that can eventually lead him to diabetes. And try the fatty liver part, which you elucidated just now. The fatty liver is basically because of excess amount of rice that is coming into our body. We take too much of rice items. So moment you take to it, then that becomes a fuel for the liver to produce more cholesterol. And then this cholesterol is not used because the sugar is not able to move out from the blood, and there's no movement at all. You need to burn the calories. You need to understand that. So fatty liver, of course, is a major problem. It is more so for alcoholics. Just for a normal eating person, because all South Indians, we tend to do too much of fried items and all those things. And that is where the problem is. Now you look at, I'm just going to highlight this. This is very important for everybody. Look at the oil marketing. Have you ever looked at the advertisements for oil? The biggest culprit in our homes is the oil. You have a family of 4 members and you're consuming 8 liters per month. That means every member is consuming 2 liters. Can you imagine? The recommendation is only 500 ml. The tolerance which the liver can take is only 500 ml per head per month. And because of this, excess amount of fat gets accumulated. Imagine taking a vada, 3 teaspoons of oil. Take 2 vadas, half a cup of oil. How are you going to get this washed out? In the night when you had a fried bhindi in your pan, and next day you tell your lady to wash the pan, 3 liters of water is required. Little bit of scrubbing is required. Half of soap is required to wash it. Even then you will have a little bit of slimy feeling. When outside is such a big problem, can you imagine what's happening within the system? So this is where the tendency to develop fatty liver. So oil, you look at the advertisements. They first show a small child. Then they show a young couple in jeans and t-shirts. And then they show the grandparents. They're also in jeans and t-shirts. You see, this is how the travesty of things is. And now, quite surprisingly, have you ever gone into the supermarket to buy an oil packet? You would have found all those things will be written fortified with vitamin A, B, C, D, E. All the oils have been fortified. Did anybody pick up a groundnut oil packet? You pick up the groundnut oil packet, you will not find a single fortification because it cannot be fortified. By naturally, it has everything in it. Our ancestors ate all that. They never went for anything refined. So cold pressed oils are the norm. This is the best thing you can do. Consume in less, but take cold pressed oil. The best of the oils for Indian setting for our people is the sesame oil, mustard oil, rice bran oil, sunflower oil, groundnut oil, and coconut oil. You need to keep changing the oils. Every fortnight, keep changing the oil, and you get the best benefit of all of them.
Thank you so much, Doctor. In the interest of time, we will take one last question. This is from Sanya Fernando. She says, my mother-in-law has diabetes for the past 30 plus years and is on a lot of medication. Is there anything that she can do to avoid medicines and still keep her sugars in control by with the help of food?
Yeah. See, as long as the disease has been there for a prolonged period of time, and still she has to be on certain medications. So I don't think that excess medication is also helping her in a way. I think she needs to consult and we find out why the other things are going wrong. What are the things that have been not happening in the lifestyle cycle? For example, sleep, exercise, and these elderly people have a lot of mood elevations. You cannot enforce things on them like how you want it. Your emotions say that eat, no, I got it for you. It's not like that. How beautifully you hand it over to them and say, Mom, today I got this for you. Just the change of pattern and tone will make the difference for them to agree and accept. The biggest problem here is that our emotions are so charged up, we sympathize with ourselves more. We tell, I got this for you. In our childhood, they got many things for us, but they never opened their mouth. But now we get it and we are trying to enforce things on them because you wanted to go into their stomach. But there are ways. There are ways for which they will like it. This is the way they want to have it. So make sure that if they are taking too many of the medication, they need to. I don't believe in the policy of unnecessarily making a polypharmacy for them. I more believe on this is the lifestyle disease. Concentrate more on the lifestyle. Find ability within their own lifestyles. If they're not doing exercise, make them do. Even on the sitting on the chair, they can do certain exercise. I'm sure I will share this session of doing simple exercises on the chair. You just don't need to run. What you are running for 2 kilometers and burning that much calories, I'm sure by God's grace that the exercise which I have designed, you could just do it sitting on a chair. Anybody can do it. The elderly, the most obese, the people with arthritis, anybody can do it. They're very simple exercise. I could have definitely given a demo, but I do not know how to go about adjusting this.
Thank you so much, Doctor. I think that would really help all our listeners today. So, for everyone who could not ask their questions, I am posting my email ID here. You can write your questions to me, and I'll have it sent it to Doctor, and I'll get answers from there. Thank you so much, Doctor, for coming in today and giving us a wonderful session. It's been we've heard some great insights from you in terms of our food habits and our lifestyle habits and what should be done, especially the family pedigree that you spoke about. It was a great insight. Thank you so much once again for coming in. And thank you so much, everyone, for joining us today and be a part of the session. We'll look forward to the next session next Friday from 3:30 to 5. Thank you so much. Thank you.
Thank you so much, sir. God bless you all. Take care. You only live once, live right. That's what is important.
That's a great advice. Thank you, Doctor.